Hello, Professor Mera and my all classmate. My name is Veerpal Uppals. I'm going to represent my soup note on osteoarthritis. I seen a 74 years old male patient, white American. His date of birth is October 11, 1949. Insurance is Medicaid. He's married. His chief complaint is left knee pain. He's 74-year-old African man who represent in the clinic complained of left knee joint pain for several months. The pain he stated that the pain in the left knee joint is a year ago, but it was worse and off. However, 2 months ago, the pain reported feeling significant stiffness in the joint when moving from a sitting position. He also says that his left knee also warm, but the stiffness and pain reduced as started moving about. SG knows that the pain and stiffness in the left knee have been affecting his movement and daily work, but in the past month, the stiffness has been persistent and pain has also been worsening when he stands or walk for several extended periods. So his pain level right now 6/10. His pain was like 3/10 few months ago, but now his pain is increased. He's taking Tylenol for mild stiffness, and he feels forced to move body house with sport. So he denies any trauma in the left knee. And SG report that the pain has not significantly affected his sleep and appetite. His medical history is none. His flu vaccine 6 months ago. His surgery at the age of 22, appendectomy, and hospitalization once following appendectomy surgery. Allergy, no food and no drug allergies. He's just taking Tylenol 1 gram PRN for knee pain and a multivitamin daily. The family history: father died at the age of 79 with hypertension and diabetes, and mother and maternal grandfather mother had arthritis, but he died with the of the natural cause. Paternal grandfather had asthma and obesity complication. Wife 63, no any health issue this time. He has a three healthy kids, and no any family member has major health problem. His social history: he retired school teacher. He worked 30 years ago, and he worked over 30 years, and now he helps his wife to buy grocery. He's married, so his kids are healthy. So SG eats healthy meals home prepared by their nanny, but rarely engage in physical exercise. So Ross constitutional, he denies any chills, fever. Eyes are normal, no redness, no discharge. Ear, nose, mouths are normal. Cardiovascular, he denies any pain. Pulmonary wise, lungs clear. Gastrointestinal wise, he's no complaint of nausea, vomiting, and no loss of appetite. Genitourinary and gynecology, he denies any frequency of urine or frequency, urgency, or burning sensation when he avoiding musculoskeletal. He reports left knee joint stiffness and pain worsening in the morning and slightly improving as he tries to move around. However, he denies back pain or muscle pain. Neurological, he is alert oriented. He denies any cold and healthy intolerance, excessive sweating, and increased thirst or swollen gland. So vital sign: his blood pressure is 134/72, heart rate is 81, respiratory rate is 21, oxygen saturation is 98, height 5.7, weight 153, and BM 24. His labs radiology or other patent studies: rheumatoid factor negative, CBC normal. Test to order include x-ray and joint fluid analysis. Physical exam: his general appearance is well nourished and cooperative, looks like he's stated as skin moist and warm. His Here is normal distribution, no scar, eyes cleared, conjunctiva and sclera perla and intact. Ears canal is clear, no bulging. Nose no knee, no patent nasal and no septal deviation noted. Supple neck, supple with no scar or swelling. Um, Throat, no any arrhythmia, and no any pharynx with no exudate, musculoskeleton on inspection. The left knee joint is swollen and reddened with no significant deformities. The left knee is standard warm than the right knee on palpitation. There's no corruption on the left knee joint, but the range of motion is limited. For range of motion in all other joints with no deformity. Cardiovascular normal capillary refills with pulses 3, regular heart rate SN1, S1 and S2 is normal with no murmur. Respiratory wise lungs clear. Gastrointestinal wise no nausea, no vomiting and bowel sound present in fourth quadrant. Skin is clean, normal, trigger and no lesion, no rashes, psychiatric issues, no alert orient times 4, and he's speaking very clear. Lymphatic wise, no tender lymph node. So assessment differential diagnosis, osteoarthritis left knee is the pain most likely diagnosed is the case of SG supported by the patient complaints of left knee joint stiffness and pain and swelling, tenderness, reduced flexibility to the same joint on physical examination. According to the Sharma, osteoarthritis is a chronic degenerative joint disorder that occur when the protective cartilage that cushions the ends of the bones wear down over time and associated with the pain, stiffness, tenderness, loss of flexibility, grating sensation, and swelling of the affected joint. Additionally, the pain has a family history of arthritis, which is another non-modifiable risk factor in developing osteoarthritis. So, rheumatoid arthritis is probably diagnosed the case of SGs for the patient complains of tender, warm, swollen joint and joint stiffness. There was in the morning and after activities. Idiopathic gout left knee is another problem diagnosed for SG supported by the patient complains of left knee joint pain, stiffness, swelling, redness, and tenderness. X-ray signs and symptoms and gout include intense joint pain and so the primary diagnosis is osteoarthritis, left knee, plan diagnostic, and amazing test like X-ray to generate images of the knee abnormalities, body test, ESR, assess inflammation, and blood test assessing the presence of uric acid in the blood. Treatment is naproxen sodium 550 twice a day to relieve osteoarthritis pain, and therapies include physical therapy or strength muscle around the affected joint, education, patient education to engage low impact exercise to strengthen the muscles around the affected joint, and then need to lose weight to lower stress on the knee joint when walking or standing. Follow up 1 week after initial treatment, assess the pain level and determine if the quality of life has improved or whether the client needs more potent pain reliefs or surgeries. Thank you.